So readmissions are a keen area of focus at our hospitals, as are every hospital in the United States right now. We spend hundreds of thousands of dollars, millions of dollars trying to reduce the risk of readmission, both in the hospital and afterwards. We know that patients, when they're admitted to the hospital, particularly older adults, often lose physical function during their stay. So the STEADI initiative that we've been implementing helps us find those patients early and plan for that post-hospital care earlier in their stay so that we're not surprised or are not aware of loss of function on the very last minute, the last day of their hospital stay. They're of keen importance to patients as well, because when you return to the hospital, obviously something hasn't gone well and you're often not recovering as quickly as you would like. And a fall is the worst possible example of that. If you go home after being treated for pneumonia, come back with a fall-related injury, that seems particularly bad and something we hate to see happen. The STEADI initiative has been helpful in giving us a framework to plan for that work early. Our first step in the STEADI pathway at UCSF is empowering the nurses to use some of the documentation they're doing already, and addition of the STEADI questions, to automatically be able to consult physical therapists who are among patients who are at highest risk. That allows the physical therapy treatment to start earlier. The next step is involving physical therapists in the care of patients who are at highest risk. And those patients, the physical therapist sees them daily to help improve their mobility, and often assign or suggest a place of care after hospitalization, like a skilled nursing facility, or suggesting additional home supports like home physical therapy or home nursing. The last step before someone leaves the hospital, patient leaves the hospital, is the physician is prompted to screen the medication list and discontinue any medications that are harmful. At the same time, the physician is asked to add information to the discharge summary that is tailored to the patient's needs around post-acute care and access to community supports like physical therapy or Tai Chi. That same information goes to the patient so that they have the same education and they can make their own choices as they need to. This is a key step for us at UCSF. The goal really is to make sure that people leave the hospital with better function than when they came in. Our team has really represented the UCSF model for quality improvement by being really interdisciplinary. Nurses, pharmacists, physical therapists, physician assistants, practitioners, we value all their input equally because all of us are trying to provide the same type of care to our patients. We may do different parts of the care, but we're all aiming for the same goal, and I think that's been a really key part of what has made this program successful. This is about helping patients get better, and that's been inspiring for all of us.